CEN Certification Prep. Question 1. A patient presents with coffee minus ground emesis and melena. What is the priority nursing action? Option A. Administer 4 fluids. Option B. Insert a nasogastric tube. Option C. Prepare for blood transfusion. Option D. Assess airway and breathing. The correct answer is option D. Assess airway and breathing. The ABCs take priority. Coffee minus ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. 4 fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment. Question 2. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase, A, and lipase, B, are diagnostic, they do not indicate severity. Elevated glucose, C, is common but less concerning than hypocalcemia. Question 3. A patient who is intubated and mechanically ventilated has a sudden decrease in SpO2 from 95% to 85%. The ventilator alarms are sounding with high peak pressures. What is the first action? Option A, increase VO2. Option B, assess for a disconnection. Option C, manually ventilate with a bag minus valve mask. Option D, suction the endotracheal tube. The correct answer is option C, manually ventilate with a bag minus valve mask. When an intubated patient experiences a sudden drop in SpO2 with high minus pressure alarms, the immediate action is to disconnect from the ventilator and manually ventilate with a bag minus valve minus mask, BVM. This allows assessment of breath sounds, compliance, and tube patency. Increasing VO2, A, may help briefly but does not address the underlying issue. Suctioning, D, may be needed later. A disconnection, B, would cause low minus pressure alarms, not high pressure. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 5. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion. Question 6. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A, administer pain medication. Option B, perform a neurological assessment. Option C, prepare the patient for a CT scan. Option D, establish 4 access. The correct answer is option C. Prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and 4-axis, D, are important but secondary to diagnosis. Question 7. A patient is bitten by a venomous snake. What is the priority nursing action? Option A, apply a tourniquet above the bite. Option B, immobilize the affected limb. Option C, administer antivenom immediately. Option D, incise and suction the wound. The correct answer is option B. Immobilize the affected limb. Immobilizing the affected limb and keeping it at or below heart level helps reduce venom spread. Tourniquets, A, are contraindicated as they can cause ischemia and tissue necrosis. Antivenom, C, is administered after assessment and only for systemic toxicity. Incision and suction, D, are no longer recommended and can cause further tissue damage. Question 8. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A, apply heat for the first 24 hours. Option B, apply ice for the first 24-48 hours. Option C, begin range of motion exercises immediately. Option D, avoid immobilization to prevent stiffness. The correct answer is option B. Apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. In triaging a patient with abdominal pain and a fever of 102 degrees Fahrenheit, the nurse should assign which triage category based on the Emergency Severity Index, ESI. Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. ESI 2 is for high-risk patients who are not in immediate danger but require rapid assessment and treatment. A patient with fever, 102 degrees Fahrenheit, and abdominal pain meets criteria for ESI 2, high-risk. ESI 1A is for life-threatening conditions requiring immediate intervention. ESI 3C is for stable patients requiring 1-2 resources. ESI 4D is for stable patients requiring no resources. Question 10. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A. What is the patient's blood pressure? Option B. What time were the patient's symptoms last known to be normal? Option C. Does the patient have a history of hypertension? Option D. What is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important, but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical. Question 11. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Question 12. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option A, systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 13. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A, palliative care begins with the initial diagnosis and continues through the end of life. Option B, the patient cannot change their end-of-life decisions once enrolled in hospice. Option C, there is an important legal distinction between withholding care and withdrawing care. Option D, a living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 14. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. 4 fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 15. Which of the following is a true statement about do-not resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A, it means no CPR. DNR is not a standing order, B. Family, D, cannot write the order but can participate in discussion. Question 16. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 17. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12- lead ECG within 10 minutes. Option B, start 2 large bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A. Obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 18. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96-100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with acute urinary retention. The nurse anticipates the need for Option A, Foley catheter insertion. Option B, straight catheterization. Option C, condom catheter. Option D, suprapubic catheter insertion. The correct answer is option A, Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 20. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A, positive Kernig's sign. Option B, positive Hohmann's sign. Option C, positive Brzezinski's sign. Option D, both A and C. The correct answer is option D, both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Hohmann's sign, B, is associated with deep vein thrombosis. Question 21. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra- abdominal bleeding. Assessment of vital signs and signs of shock are the priority. For fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 22. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has Option A, a possible infection. Option B, positive blood cultures. Option C, an immunocompromised state. Option D, been febrile over 24 hours. The correct answer is option A, a possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 23. A patient with a urinary tract infection presents with confusion and fever. What is the most likely diagnosis? Option A, uncomplicated UTI. Option B, pyelonephritis. Option C, urosepsis. Option D, interstitial cystitis. The correct answer is option C, urosepsis. Confusion and fever in a patient with a UTI, especially in an older adult, suggests urosepsis. This is a life-threatening infection requiring immediate intervention. Uncomplicated UTI, A, does not cause confusion. Pyelonephritis, B, causes flank pain, fever, and chills. Interstitial cystitis, D, causes chronic pelvic pain. Question 24. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, board-like abdomen. Option D, a flatulence. The correct answer is option C, rigid, board-like abdomen. A rigid, board-like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than board-like rigidity. Flatulence, D, is not concerning. Question 25. Which of the following is a contraindication to the use of continuous positive airway pressure, CPAP, in a patient with respiratory distress? Option A, COPD exacerbation. Option B, hypoxemia. Option C, confusion or inability to protect the airway. Option D, mild asthma exacerbation. The correct answer is option C, confusion or inability to protect the airway. CPAP requires a patient who can protect their own airway. A confused patient or one with an unprotected airway is at risk for aspiration and should not receive CPAP. COPD exacerbation, A, is an appropriate indication, as are hypoxemia, B, and asthma exacerbation, D, with caution.